February is Heart Health Month, which makes this a perfect time to pause, check in with ourselves, and talk a little bit about the small choices that can make big differences long term. Joining us today is Deanna from Omni Family Health, who's here to help break down the things in a way that actually feels doable. Now, Deanna, heart health can sometimes feel like something we only think about when there's a problem, but why is February such an important moment to bring this conversation front and center, especially for the communities that Omni serves?
Well, here in Kern County, we have some of the highest rates of heart disease-related death in all of California, which is really sad, right? It affects all of those that we love, our coworkers, our friends, our families. Heart disease can hit us really hard, but it is very preventable. So February is our opportunity to spark these life-changing conversations and hopefully get people through our doors for a checkup.
We hear terms like high blood pressure and high cholesterol, but they're often called silent for a reason. So why are they so tricky, and how would someone even know if they're at risk?
Exactly. So we hear high blood pressure and heart disease. Sometimes they're referred to as silent killers, right? These silent conditions, because you might not feel any symptoms at all. You might feel fine. And patients do tell me that. A lot of times they'll say, I don't have high blood pressure, I feel fine. But you might feel fine, but your heart is really struggling on the inside, and you really won't know your risk until you come in and get checked out. It is a quick checkup that could potentially save your life.
All right, let's talk real life. When it comes to heart health, what are a few everyday changes that actually move the needle without flipping someone's routine upside down?
I tell my patients all the time, we have modifiable risk factors and non-modifiable risk factors. So things that we cannot modify, genetics, blame mom or dad for that, right? But the things that we can modify, are going to be those little micro changes in our life. Maybe you're drinking an extra glass of water, or maybe you're cutting back on your salt intake, a 10-minute walk every day, maybe 10 minutes to just de-stress and meditate or pray and kind of relax and calm your mind. These are the tiny wins that are going to make a big improvement towards your heart health.
Now, I hear Omni offers remote blood pressure monitoring, which sounds like a game changer. So can you walk us through, how this works and how managing your blood pressure at home can be so helpful?
This is one of my favorite programs. We call it our RPM program, which stands for Remote Patient Monitoring, because basically what we're doing is we're giving patients a smart cuff. So they take the blood pressure cuff home, and when they take their blood pressure, it sends those readings directly to our system and directly to your provider. So we are able to see what you're doing and how your blood pressure is, not what you're doing, we're able to see how your blood pressure is doing at home in your normal daily life versus just at the doctor's office, and it helps us to treat you better in real time.
And for anyone watching at home who feels a little overwhelmed or maybe unsure of where to start, what kind of support does Omni Family Health offer to help people stay on track and feel confident about their heart health?
I think it's important for patients to remember that you're not doing this alone. Here at Omni Family Health, we have an entire team of professionals that want to help you through this process. We have doctors, other providers, nurses, educators, and really cool tools like the Remote Patient Monitoring Program that can help walk you through this step. So don't feel like you're alone. We want to support you. Here, we're going to help you manage your medications. If you don't feel good on one, tell me. Let's change it to something else. There's always another option, and we don't know unless you come in and talk to us.
Deanna, where can people go to get more information if they don't know where to start?
It's easy to reach our providers at Omni Family Health. Just give us a call. We also have text options, and we can help you schedule your appointment to have your heart health checkup.
Thank you so much, Deanna. It was great having you on again.
Thank you.
And with that, we'll be back with more Studio 17.